Sorry, Google Air. We're live now, actually.
Really cool. Yeah, so they wanted to go over briefly what's on the data platform. So in the just give me a yeah, just give me that, right? Yeah, I can do it.
I'll sit up front.
Are you doing the hangout or on air?
Let's put it out there. Retweet it.
Anybody's doing it?
No.
You can sit up there on the steps. No, it's going to be.
Ooh, that's
Hang out there for now, I guess.
Alright, you're getting started?
Yeah.
Okay, everybody, get back to me. We will be starting the pitch information briefly, but we actually had a really meaningful request come up from the crowd. We had a request to kind of have a brief review over what kind of data is contained in the open data world. Because if we find out a little bit more about what kind of data is available there, maybe that'll spur some additional potential ideas on behalf of the pitchers out there. So I'm going to get Ian from the Data Tiger team to kind of talk a little bit about what kind of data.
So we got MyState, which is a synthetic but if you just from here to the data catalog, this will. Okay, I'll get that. There we go. So when you start looking at this, there's information about extra data sets. Some are just links to data sets, so they're external data sets. There are some different views here as well. So if you just want to look at sets if we want to quickly just run through these. Um, Okay, so, so on the data portal, there's 15 data sets, and there's more links to external data sets. But, we've got information here on parks and rec facilities, information on county restaurants, healthcare costs by county and census tract. There is some information here about county housing, county education, some demographics and health plan data. And then here you also have the food access survey, farmers market information, county health rankings. Let's also look at the external data sets, because there's a lot of information you can get on these. There's some information about the Medicare physician billing, which just became available. And then there's all these MICE data sets. It's a synthetic data set that you can use for the census, because the census information typically isn't given out for some time. But this is RTI has gone through and taken that census data and created a synthetic data set. So this is actually, it won't give you to the house, but it'll get you in the general area. You'll have the same education and age ranges and that sort of thing in kind of aggregate form. So that can be very helpful in some of the analysis when you're matching data against. You want to get some population information. And then there's some information here on Center for Disease Control prevention information, substance abuse. Here's the link to the data.medicare.gov site.
Hey, Ian.
Yeah.
The North Carolina Community Health Information Portal is
So the one in the middle, the North Carolina Community Health Information Portal, is a link off to a plethora of very interesting, obviously, North Carolina data sets that you can sort by county and city. Zach, any few words on that? Any additional words on that link off to the North Carolina community? There's just a lot of valuable data.
So that's all the Medicaid level people who monitor on Medicaid, Medicare, and disease state information about demographics, provider networks, just lots of information. We pulled that a little bit as the same. If you're interested in that North Carolina specific data, really good data set.
Yeah, absolutely. Thanks, Ian.
And then just the last one, there's information. There's another open data, OpenNC, which is a collection of digital records. There's a lot of restaurant inspection data here by county, but that's static data. It's not refreshed frequently. But you've got information on this state of the county's health report for Wake County, and then here's the National Toxicology Program. So if that gives you an idea of the flavor of the type of data sets.
ultimately they can upload anywhere in this place.
Okay, so I can say.
Sorry to keep interrupting. So this portal is your portal, which means over the event, over the next several months, if you need a place to host data for your project, data that you maybe got on a USB key or you scraped off a website or got it in normal ways, and you need a place to put it, and you can host it on this data set. And from a geek perspective, all data is API enabled once it's on here. So if anybody from the Tiger team that you saw in the photo, come up and find them, they'll get you access to this and also answer any questions that you have.
All right. Question in the back?
The data is fairly static. But is this data going to be continued to be open over a period of time? you're building some innovation or coming up with some ideas based on the availability of this data as we stand here today. Will this data be available in the future? Did you look at that and you capture the data?
You got that?
No.
Yeah, so that's a great question. The data that's on this portal, obviously we don't work for government, so a lot of it is going to be static. That's natural. The automation of the flow of data has to happen at the government level, so that's got to happen. So to answer your question, are you saying literally will this data be here on this portal for the long haul?
Will be available in the future
Yes, absolutely.
from whatever source.
From whatever source. I think what's important is the metadata attached to each of those data sets has the name of the government agency of where it came from. So if the Tiger King can only get you so much and you want to get more automation of flow of data, the most fresh, then you would need to contact that agency. But I think this event is kind of that call for action to say, hey, thanks for the great snapshot of data, but to do this app to solve this problem, we have to have the latest and greatest. And so that's why we're doing this whole weekend. So great question.
So just a review about how this process is going to go. You're about to watch a group of pitches from people who would like to have a project idea worked up to present on Sunday night. That's just going to be kind of great. So what they're going to be doing here is they're going to be trying to win your vote to attract you, their team. So please be kind and give them your they're going to be good pitches to explain who they are, what the problems can be, what's your approach to resolve the problem, given the weekend, and who you need to be in. And you can take 60 seconds long. When you're 60 seconds up, I'm going to be taking the envelope. You will take the envelope over to the side of the counter there where they're at the end of your pitch, let the audience know what name you're going to be writing on this envelope. Once you are done writing the team name on the envelope, place it on one of the tables in this room. And when all the pitches are over, we'll be sending people through that room to drop off their votes. Everybody got it? Anybody have any questions about what's going on? Good, that's okay. Well, let's get started with the pitches then. Who'd like to go first?
Hi, my name is Alicia Hardy, and I came tonight to really just participate, but I got a call from a friend of mine 2 hours ago out here, and she made a request of me to pitch an idea of something that her work group would like to have. She has her PhD as a clinical researcher, and for me, I have a master's degree in health informatics, and I extract that data from electronic health records. And her request, she does clinical research at Campbell University and for the VA, and she's clinical research and everything, and she has a pharmaceutical degree. But they're wanting an electronic health record for the patients that they work with. The patients that they work with have chronic diseases such as diabetes. And so they want it so that when these patients are on the go, they can have access in whatever country they're in to their electronic health records. And so the main parts that they want. Okay, thank you.
So, an on-the-go health record for patients with diabetes. What name would you write on the
EHR on
Can you get upstairs?
So the suggestion to stay on the stage. How many of you disagree
agree that time is the most valuable resource in this fast-paced life. How many of you agree that we waste a lot of time sitting in a provider office, filling out forms, checklists, to wait for your time slot to meet the provider? Some interesting facts from CDC. On an average, patients across US make 1 billion visits to different facilities with an average wait time of 45 minutes to 60 minutes. That's a lot of time. We have engineered a real-time integrated solution for providers and patients, which allows the patients to walk into a provider office on time and knowing which doctor they are going to meet and which cabin. And what is missing? No paper, no checklist, no wait time. And we need some product engineers and guidance from mentors, and we represent the idea on-time care. Thank you.
On-time care. Okay, next up.
Well, we all know why we should stay in shape. Well, what gets us going to act on that idea? Well, what motivates people to get out and be active? I'm sure many fitness seekers have had experience with personal trainers, coaches, and/or fitness instructors where they have walked away from it thinking they really don't get me. That instructor just wasn't my style. I had they train me like I'm some sort of extreme athlete. But some have found that one trainer, coach, or instructor that has that perfect match. That's why I say it's a matter of compatibility. Oftentimes, there's simply a divide between the client's personality or training purposes and the trainer's training style. What if I could present you with a tool that allows the trainer to better understand you, your motivations, likes, and even dislikes? My inspiration is chemistry.com, maths.com, even LinkedIn. I would love to bring this idea to reality, so I'm seeking developers, engineers, or other bright individuals to collaborate on this idea. Thanks. U-turn.
U-turn?
Yes.
All right, thank you.
My name is Chad Christensen, owner of a company called Sound House. We have mobile apps. The app we're talking about tonight is for allergens called Health Bite. Every 3 minutes, food reaction allergies send someone to the ER. 8 foods account for 90% of all food allergy visits. Our app's really simple. You put in what type of things you're allergic to, what type of things you need to be notified of. Take a picture of any UPC code, any food that you're about to eat. It lets you know if there's something that's problematic with that. Gives you alternatives if you need to. Down the line, we're looking at opportunities to include diet in here for paleo, vegan, whatever. It'll also alert you to those things. I need everybody across the board. All of that is the idea. So anybody who's interested, let me know. Again, the name of the app is Health Bite, B-Y-T-E. Thanks a lot.
My name is Aaron Terry. I work for Blue Cross Blue Shield. The problem we're trying to solve is looking at how much of a barrier to health that cost is. So I am proposing analyzing data about costs in different areas versus the community health ranking to see if we can find that there's a relationship between the cost and how healthy the different communities are. And then I would like to put together a marketing plan of some type to give to governors, city officials to let them know about this, show them this data, and see if we can work toward reducing those costs in the areas where there's barrier. I need analysts to help me analyze the data, and there's business people who are interested in working with policymakers and making marketing plans. Cost is barrier.
Cost is barrier. Okay, cost is barrier. Hey, we got some more pictures.
Thanks.
Hi guys, my name is Art Gibson. I was working for a officer in Nevada. I'm an actuary, and we have a problem where, this new healthcare environment carriers are being reimbursed for both the risk of their population and the quality of care that they provide for their members. So what my app is trying to do is A, send friendly reminders to both their members and providers with their apps and coverage for members with specific chronic conditions, and B, provide a platform for these members and for providers to code their ICD-9 diagnosis code that can be submitted back to the carrier. So, and essentially what it's doing is incentivizing both sides, so that we don't necessarily, so that we know what the health is of our members and we know they need a care, basically. So my app that I wanted to be called is Closing the Gap.
Close the gap. Interesting.
Good evening. My name is Asam Vakil, and I'm here with a couple of my teammates to present an idea of an innovative software solution for hospitals. Section 3025 of the new healthcare law or Obamacare requires CMS to reduce payments to hospitals that have access readmissions. According to the estimate, total cost of readmissions in the United States is about $10 billion per year. The software that we plan to build would analyze and produce a dashboard of indicators by analyzing patterns in claims data and using those patterns to predict the likelihood of readmissions for a particular patient. Using those dashboard indicators, the hospital administrator would be able to do some proactive analysis and do whatever needs to be done before a patient is discharged from the hospital. We have a total of 10 years of analytics experience among us, and we would need a web developer and a marketing professional in addition to venturing from judges and other entrepreneurs. Our team is called NPHR, or No Preventable Hospital Readmission. Thank you.
NPHR. And you come downstairs to activate. Any more?
Hey, hi, my name is Banan, and primarily my idea was to kind of, primarily in any organization, whenever we make any kind of change in the strategy or want to make any decisions, all the people who are partnering with the team shares a story to the organization or the stakeholders. And whereas with respect to our decisions, where if we want to visit a doctor or visit a provider or a facility, we always have the tools available in the internet, or which doesn't give you the whole story actually, but it gives you very subjective information. So when I saw this opportunity, when I looked at the data portal, recently the Medicare had released the physician billing data as just one of the data types I just mentioned a few minutes ago. So we want to leverage that, as well as we don't want to make the customers make the decision based only on the price, because there is a lot of hiccups from the provider community that, hey, why are you not looking at our quality data? So we want to build a portal application where we need to, such that we can educate the customers to make a decision through both the cost as well as quality, and as well as some personalized information about the customer. Sorry. Analytics for 65.
Awesome.
Anybody else? If there aren't any more pictures, make sure that the names are on your envelopes, and let's go ahead and get them on in here. Let's see. My mark says 8:25, so let's give you 20 minutes to vote. Let's plan on being back here in this area around 8:45, so we can hear what pitches are going to get picked up. All right. Thanks so much, everybody.
So what do you guys think?
Well, that was a lot of pitches, more than I thought there would be. So I was
I really heard some that I like.
Yeah.
And there's some that I want to find out more about, so I'll be talking to the people who pitched to find out a little bit more about those. But I've got a few favorites already. I'm not going to tell you who they are.
Sure. Awesome.
Myself.
Awesome.
I'm really excited.
Cool.
Yeah, there's only a couple that maybe I could work back to the data. You know what I mean?
Yeah.
And others were just kind of an app focus. So I think I'd lean towards more where we know that there's data there. You know what I mean?
Do you guys think that some of these ideas are good in spirit, but maybe don't necessarily equal a financial reward?
Oh yeah, definitely. I think one of the first one seemed to be based on people who need help doing research for public good. There may be some problems with security and privacy with that particular pitch.
Right.
I think it's a good idea. It's a good in spirit.
Sure. It's a good challenge.
Yeah.
Cool.
I would love to attack that as a problem. But I do see there's probably some concerns there that people might have.
Sure.
Being on the go.
Yeah. All right. Well, guys, good luck. Good luck voting. So how did you think it went, Jim?
I think it went pretty good. Interesting pitches.
Yeah? Got any personal favorites that you want to share?
Well, so...
or do you need to stay neutral as the
no, these is definitely not your usual pitches. It's like that health focus is really standing out. I think the one that's kind of most the one that at least kind of caught my imagination the most was the one about the dashboard for readmission. That's one of the things
Absolutely.
That's one of the things that I know just from what I have a limited knowledge of the healthcare sphere, but that's famous for being one of the big problems. Is those problems with readmission.
Yeah, I think I'm interested to see if folks track towards that one as well.
Yeah, and it'll be fascinating to see if they do get picked up. It's going to be fascinating to see what can really be done in a weekend with something that's been such a big deal for such a long time.
Absolutely. Thanks, Jim.
People who have been so that we can talk to them.
Hey, great pitch. Where'd you come up with the idea?
This is like a collaborative effort between me and her because this is my twin sister here, Jessica.
Hey, Jessica. Nice to meet you.
So yeah, basically it's two of me, I guess you could say. But
Everybody,
basically my mom, she's a personal trainer, so she's been doing it 20 years, basically all my life.
Yep.
I don't know anything else.
All right. So, well, just so have a look. Everyone, if you have questions for the people who pitched, they're raising their hands right now. So have a look at them, take a look at their faces, see if you can track them down later with any questions you might have about
How'd you think it went? Any personal favorites?
I'm not gonna weigh in. I'm not stirring the pot.
You're not gonna stir the pot, huh?
I know.
All right.
There's some I like though.
You recording? Yeah.
Great. Hey, everyone should be here.
Hey, tell us about City Camp.
I just flew in from Atlanta, and boy, are my arms tired. City Camp's coming up in 2 weeks.
Yeah.
We'll have May 29th through May 31st. We'll start off things with the architect in Raleigh. We've got a keynote speaker, Bill Greaves, CIO of Wake County. We've got 8 lighting talks lined up, maybe more. I don't know. We have to see what we get. And then we'll have a full unconference on Friday at William Peace University.
Okay.
It'll be very similar like this. People will get up, they'll do some pitches, we'll get some ideas, and then we'll create sessions for the rest of the day. And by the end of the day, we'll have teams formed. They'll be competing for a $3,000 cash prize, some consulting with some consulting from the startup community, and they'll be working all day Saturday. And if you don't want to work on a team, you can come to our hackathon. So we'll have some cool projects lined up for you on Saturday.
Absolutely.
It's gonna be a great time.
Thanks, Jason.
And it's only $10.
Only $10.
Gosh. And you get a free T-shirt.
T-shirt
So,
and breakfast.
And breakfast, yeah. Bill Greaves started up open data for Wake County. He did, yeah. I think he's gonna be talking about that. That's good.
Thanks, guys. Thanks for you.
It's like Jason.
How would you